introduce what is leukemia. Leukemia is a cancer about the blood and marrow. Characterized is it can produce abnormally a white blood cells. And as you can see this slide, there are 4.9 main causes of leukemia. And today we are going to shortly talk about gene mutation. And gene mutation is mean of the DPI cell, which is translocation of chromosome 9 and chromosome 22, and cause fusing BCR and ABL gene. And let's start by the first question. Is it possible to detect leukemia earlier? And the answer is yes. There are two methods. The method one is NGS and AI. NGS is homing is next generation sequences. It is a powerful tool which can analyze a patient's DNA. It helps find a gene mutation or abnormalities, which can doctor in diagnosing the disease and choosing the treatment. And now let's focus on AI. In recently, AI has already proven its immense mode which can diagnose it. It helps us overcome some challenge complex data. And now you can see in this first point, genetic data can analyze like NGS. Second, it assists cell analysis which can like flow symmetry. Third, it can integration of multiple data types like genetic merging, cell code, or clinical information from complete images. Now let's focus on future. AI can make introduction of complete data to provide earlier detection, high accuracy, and personal protection, while it may automation assisting in development of new therapy targets.
The next question is there really a vaccine available for leukemia? The answer is no. Right now, there is no approved vaccine that can treat or prevent leukemia. Leukemia is a type of blood and immune system cancer, which makes it very hard to target. Because the cancer cells are from our own body, so the immune system often fails to recognize them as enemies. Researchers are developing therapeutic vaccines, which aim to train the immune system attack leukemia after diagnosis rather than prevent the disease. Some early stage trials, such as personalized vaccine for acute myeloid leukemia at UCSF, are showing promise but none have reached clinical approval yet. Artificial intelligence are playing a key role in speeding up this research. AI can analyze large genetic and protein data sets to find unique markers of leukemia cells, which that is the specific feature that vaccine should target. AI can also simulate immune reaction to predict which vaccine design might trigger the strongest response before testing in human. Beyond that, AI-enabled personalized vaccine design, tailoring the treatment to each patient's genetic makeup and cancer profile. This precision approach helps improve the effectiveness and reduce side effects. In short, while a leukemia vaccine doesn't exist yet, AI is helping scientists move faster, design smarter, and bring us closer to a future where treating leukemia with a vaccine should become reality.
The importance of AI in leukemia lie on four major advantages: speed, accuracy, the ability to handle complex data, and the power to support personalized medicine. Let's look at how it works in practice. In analyzing microscopic imaging, an AI can quickly detect and classify cancer cells, helping triaging cases, reduce workload of experts, and significantly speed up the diagnosis. Second, AI proved available in analyzing flow cytometric data. Through advanced pattern recognition, AI can identify leukemia subtypes more precisely and improve the detection of minimal residual disease. Third, by analyzing genetic and molecular data, AI can text personalized care to the next level by processing large and complicated data sets. AI assists in risk stratification and predict drug responses. It brings us to a step closer to truly personalized medicine.
First, let's start with the diagnosis. Leukemia is a blood cancer. Is a blood cancer that spreads through the bone marrow, blood, and organs. Severe or relapsed patients often require a bone marrow transplant. Before transplantation, the body needs to be cleared of the remaining cancer cells, and which is why total body radiation, also known as TBI, is used. So what is TBI? TBI is a radiation therapy that delivers a uniform dose to the whole body. Because leukemia cells can hide anywhere, so full body radiation is more effective than local radiation. And this is given in multiple small doses and positioning adjustment to keep the dose even. And the main goals of TBI are remove the residual cancer cells, suppress the immune system to prevent the graft rejection, and create space for the donor stem cells. And this can increase the transplant success and decrease the relapse. And the possible side effects. The short-term side effects include fatigue, nausea, hair loss, and skin redness, and low blood count. And the intermediate tissues may include mouth ulcers, anemia, and reduced fertility in some patients. And the less common long-term effects include endocrine problems, cataracts, and secondary cancers. And what is the result by using TBI in leukemia treatment? First, it can higher transplant success rate. Second, it can lower the relapse risk. And last is better long-term survival.
First, in terms of physical and medical care, we need to monitor side effects from treatment and manage symptoms properly. It's important to help patients maintain good nutrition, enough rest, and personal hygiene. Since their immunity is weak, we should also remind them to prevent infection. Encouraging light exercise can help them preserve strength and improve overall health. Next, on the spiritual side, leukemia often brings fear and uncertainty. As nurses, we should help patients face these feelings with care and understanding. We must respect their spiritual beliefs and personal values, and encouraging them to find meaning and hope in their experience. By creating a supportive and compassionate environment, we can care for both their body and their spirit.
Hi everyone, I'm Renee, and I'm going to present how applications of AI in nursing care works. AI is becoming an important tool in modern nursing care. So first, personalized nursing care plans. AI can integrate patients' vital signs medication responses, and lab results to predict complications, such as infections or bleeding. And this allows nurses to intervene early and provide a safer, higher quality care. And the second, smart alert systems. AI continuously monitors patients' physiological data, automatically detecting abnormalities and alerting nurses. So this helps prevent sepsis or sudden deterioration and ensure timely medical response. And finally, nurses play multiple roles. We act as caregivers, educators, and emotional supporters. We must communicate effectively with patients, families, and healthcare teams. By integrating physical, psychological, and spiritual care, we can truly provide holistic nursing for leukemia patients.
This slide is about the speed of adoption of advanced medical technologies in Japan and Taiwan. In Japan, new medical technologies are adopted quickly. For example, CAR-T therapy, a cancer treatment, is spreading rapidly across the country. In Taiwan, CAR-T therapy is also expanding and was recently added to the national health insurance system. Next, I will talk about designated medical institutions and medical access. In Japan, many specialized doctors and transplantation facilities are available nationwide, and bone marrow transplantation can be done even in regional areas. However, some differences in medical resources still remain. In Taiwan, advanced treatments are mainly provided at university hospitals and large medical centers, so people in rural areas may have difficulty accessing them.
This slide is about patient numbers and impact of population structure. In Japan, the aging population is progressing rapidly. As a result, the demand for healthcare resources is very high. However, Japan also has a wealth of research and data that support the healthcare system. On the other hand, Taiwan has a relatively small population. This makes it easier to control medical costs and adjust healthcare systems when needed. Next, let's look at flexibility of systems and policy response. Japan has a careful and slow approval process for new treatments. It prioritizes patient safety and proven effectiveness over speed. In contrast, Taiwan adopts advanced medical technologies more quickly. It has also introduced temporary reimbursement systems for new therapies. Overall, Taiwan's healthcare policy is more flexible and adaptive.
In summary, Japan offers safe and well-guided medical care, while Taiwan is more flexible and innovative. Both countries still have